Republicans are out this morning saying they're being shut out when it comes to reforming health care. They're not seeing any bipartisanship. We are. We've got both of them here. Phil Musser is former senior advisor to the Romney campaign, and Josh Gottheimer is former special assistant and speechwriter to President Bill Clinton. Good morning to you both. Josh, I want to start with you. I think for taxpayers, bottom line, we're talking about spending more than $1 trillion. We want to know if what we're getting for all this money. Are we getting what we really need in this country? The Congressional Budget Office, this nonpartisan group, put out an assessment of the House bill. They said at the end of the decade, after spending more than $1 trillion, they're talking about maybe even up to 20 million people still wouldn't have insurance in this country.
Well, I don't know about that. What I do know about is that the healthcare system is broken right now. I mean, premiums have more than doubled in the last 9 years, twice the rate of wages. That's a real problem. Costs are just sky high. Small businesses are being crushed. We have to do something to fix the system. The Republicans are quick to be the party of no, and I understand that that's their job to fight against the president. But really, we need solutions here, and we're taking steps to fix it. I mean, we cannot deal with these runaway costs. We need affordable, quality health insurance for all Americans, and that's what the president's moving toward.
But Phil, the plans that we're looking at today, these initial plans from a couple of different parties on both sides here, when I say a couple of different parties, I should say a couple of different organizations. We've got different committees that we're looking at here. Do they really, though, get to the root of the problem? Are we just adding more bloat and insuring more people? But are they really solving the problems that are out there in healthcare that need to be solved to get this thing under control?
Yeah, I think that's the large question on the table, and the price tag is untenable. And the bottom line is that healthcare is a central problem in our country, and I think every Republican and Democrat could agree it's an important issue to address. But kind of the two things I think your viewers would be interested to understand are tactically what's going on here is that the Democrats, who really run the government, okay, as Senator McCain said earlier, elections do have consequences. The Democrats run the government, and what they're proposing to do is add a huge tax burden to fix a problem that needs to be addressed in a way that's ultimately questionable and in a time frame that's really being jammed by the White House with the full kind of power of the outside message effort of the Obama campaign legacy machine ginning up pressure on senators. And so I think both in terms of cost and in terms of timing, the question I would ask are we moving a little bit too quick on this, and are we trying to impose artificial timelines around the most complex reform in healthcare really in the last 25 years?
Phil, I want to stay with you for a second. I mean, is it possible, we heard the Republicans complaining this morning about the lack of bipartisanship. It's a good question, though. Is it possible to actually have bipartisanship on this thing?
Well, I think so. I mean, I think if you can take a look at a variety of different models that have been offered out there, I'd like to believe that on an issue like this, we'd be able to come together and move the ball forward with respect to, broad-based reform that really emphasizes a role for the market, that looks at solutions that are closer to the states, that understands that the root problems of cost are limited to a few places, and that ultimately a lot of the bill that's crafted that came out of the House, really is a payback to and a protection plan for a lot of unions, and it really takes a gouge out of small business people and individuals who file with small businesses in a way that's completely job killing at a time when our economy can least afford it.
Josh,
that's the fundamental argument that
I just
Republicans
have 10 seconds left. Last answer. Go ahead.
With respect to my friend, the Republicans have never shown any interest in actually working in a bipartisan manner. There are 44 million Americans without health care. Premiums have more than doubled in the last 9 years. What's going on is untenable. We have to do something about this. We can't keep kicking this ball down the road. So I would say let's all get together and do something.
Josh and Phil, we're going to have to leave it there. Thanks, guys.
Former General Motors CEO Rick Wagoner is officially leaving the company on August 1st, but he is not going away empty-handed. His pension and benefits package worth more than $10 million.